Good afternoon. We'll now start. It's already 2 o'clock. First of all, I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. So please show your face in the video. As a reminder, please take the online Learning Cum Evaluation Test exercise for mastery of learning and get the perfect score to get a certificate. I have placed the link in the chat box, or the link is already in the chat box. Another reminder, 50 OLETE certificates will entitle 1 mentees or participants to a voucher for a free telemedical consultation. Another request that I like to make is that those who are not planning to take the OLETE, in which I ask for feedback to my pep talk, and I'd like to see your feedback to this pep talk, please type your feedback in the chat box in the Zoom during the open forum or before you go away. Okay. So let's now have a group picture taking before we start the pep talk in 2 minutes. You show your face. Open your video. Okay. Some more. Okay, now last call. 1, 1, 2, 3. I have a patient empowerment program which I like to empower the lay people or patients to take control of the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9 last year, 2021. From October 23, 2021 onwards, I have been tackling health disorder or health issue courses. This may take 3 years or longer. The pep talk title for today will be Patient-Centered Care Management and Advocacy. So the empowerment objective is for the lay people to have an understanding of the concepts and principles of patient-centered care management in their health management. The contents of this pep talk will be the following. What is patient-centered care management or patient-centered care? What are the principles? Why is it important for physicians to practice patient-centered care management? Why is it important for patients to look for physicians who practice patient-centered care management? And what is the current status of Pccm in the Philippines? And then I will be presenting my patient-centered care management program and then my advocacy. Let's start with the first topic. What is patient-centered care management or PCCM, or removing the word management, what is PCC or patient-centered care? Patient-centered care management is the practice by physicians and health institutions. So both the doctors and also the hospitals. So practice of caring for patients and their relatives, kasama yung mga kamag-anak, in ways that they are meaningful and valuable to the individual patients and also to the relatives, especially to the patients. So it includes listening to, nakikinig, informing, sinasabi, at advising, and then involving the patients in their care. So essentially, this is the traditional definition of patient-centered care, listening to, informing, and involving patient in their care. I would like to add that it will also include assisting patients in their needs as much as possible, both material and non-material, as long as it's within the capabilities of the physicians and health institutions or hospital. The Institute of Medicine defines patient-centered care as follows. It's providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all the clinical decisions. So yung mga gusto ng mga pasyente, although it should be rightfully placed. And then mga preferences, okay, you have options, you have a choice, okay. So makikinig lang yung mga doctor and then try to educate, try to inform you what is the best, okay. But they have to respect your decisions. In patient-centered care, and individual-specific health needs and desired health outcomes are the driving force behind all care decisions and quality measurements. The patients are partners with their healthcare providers, and providers treat patients not only from the clinical perspective, meaning from the medical perspective, but also from an emotional, mental, spiritual, social, and financial perspective. I like to emphasize the word financial. This is very relevant and pertinent nowadays. Financial perspective. WHO, World Health Organization, use the word person-centered care, but it's also the same as patient-centered care. Okay? So it defines it as empowering the people to take charge of their own health rather than being passive recipients of services. So there must be empowerment of the patients, of the people. This care strategy is based on the belief that patient views, yung mga paniwala nila, okay, perceptions, inputs, and experiences can help in the improvement of the overall health outcomes. And one of the key ways to involve the patients in their own health is by improving the interactions between the patients and the healthcare providers, meaning the doctors and the hospitals, and making care more empathetic and compassionate, not just transactional, parang business process of transactions. No? So it must include some empathy and also compassionate care from both the hospitals and also the doctors. So with all the above definitions that I have mentioned, I would just to make it very simple. Okay. So overall, or simply put, patient-centered care is just a care based on patient's needs. Kung anong kailangan ng pasyente and their preferences. Essentially, it's listening to patients, informing them, and involving them, and assisting them, both materially and non-material aspect in their health care. Later on, I would like to ask you what could be a Tagalog translation for patient-centered care. So we'll have some interactions on that. Now, what are the principles of patient-centered care management? So at the moment, if you look at the internet, the literature, the most popular movement nowadays is this one, Picker's Institute 8 Principles of Patient-Centered Care. So when you look at the internet, when you Google patient-centered care, you're going to see these 8 principles. So these are the 8 principles of patient-centered care. Number 1 is respect for patient values, preferences, and needs, coordination and integration of care, information and education, physical comfort, emotional support and alleviation of fear, involvement of family and friends, continuity and transition, and access of care. Now, these are the things that you have to look for when you talk about a physician or a hospital being patient-centered in their care, or having a patient-centered care program in the hospital, or as well as by the physicians. I'll go through each one by one. So when you talk about respect for patients' values, preferences, and needs, so it just means that the patient preferences should be considered during patient-centered health care decisions, as this will foster a relationship of respect and collaboration. For coordination and integration of care, so we all know that there are a lot of aspect in the care, which a lot of times you also need more doctors, because no one doctor can take care of everything, so you need multiple doctors. So there is a need to improve the coordination and integration of the different doctors, and also of the clinical care and support services provided by the different doctors. So as this can help reduce the patient uncertainty and vulnerability. Information and education. So for the patients to make better decisions about their health, they need information on their clinical status, progress, and prognosis. Many patients may also benefit from educational resources that are tailored to their level of health literacy. So this will include yung mga health information in the social media, in internet. Physical comfort, basically, essentially pain management and assistance with daily needs are key to improving the patient experience in the hospitals and acute care facilities. And then emotional support and alleviation of fear. Patients should be provided with the resources needed to minimize stress and fear regarding their physical status, treatment, prognosis, as well as worry caused by financial aspect of care. As I said, this is very important nowadays. Involvement of family and friends. So we need the support from family and friends, and this should be the key aspect of person-centered care. So providers should take the needs of the caregivers, the family, and friends into account. So they should involve the relatives into the decision making, but eventually it will be the patient who will decide. But they must consider the input of the relatives. So this might mean providing accommodation and support for these patients, for the individuals involving who are supporting the patient. Continuity and transition. So after a treatment, dapat meron pang continuation, may check-up, may follow-up. No? Okay. So this is also important in the patient-centered care. So to minimize the patient concern about post-discharge care meaning after a hospital stay, umuwi na, medical providers should educate patients on the medications that they have to take, physical limitations, what they can do, what they cannot do, dietary needs, what they can eat, what they should not eat, and so on. Further, they may need to coordinate ongoing treatment and offer information on access to clinical, social, physical, and financial support. But they may assist the patients in looking for facilities for a service that is not being provided by the doctor himself. Okay, so he has to refer then, but in doing the referral, he must assist on getting a good referral for the patients. Okay. And also the financial support. He should try to help them with their financial needs. Okay. The last principle is access to care. So basically, this is it can be applicable not only to the hospital but also to the doctor. Okay, so healthcare organizations and doctors aiming to provide patient-centered care should do their best to streamline appointments scheduling. That's one example. Yung mga nakapila sa clinic, di ba? Mahaba. Okay, make referrals accessible. So access to care din yon. And provide information on transportation options. In our country, it's most likely telling them where to go to your clinic, where to go to the particular center that you have to provide information where they should go. Okay, so wag lang sasabihin, doon. Okay, so give them a map or provide, let's say, contact the referred center that you're going to send a patient there. So those are examples of access to care. Now, the next topic is, why is it important for physicians to practice PCCM? The main goal of a patient-centered care model is to improve the individual patient outcomes. Okay, yung outcome of patient care, kung gagaling o hindi, okay, or mas makakabuti o hindi. So because when patients are more involved in their own care, and they know that the doctors are taking care of them, they often recover more quickly and are more satisfied with the care that they receive. So this model of care can also lead to improved patient satisfaction score, better morale, and even reduced expenses, financial expenses. And why is it important for, again, this is another reason why it's important for physicians to practice PCCM. Okay, so as mentioned by WHO, it's important to empower the people, the patients, to take care of their own health so that there will be better outcome. Now, the next question is, why is it important for patients to seek physicians who practice PCCM? So yung pasyente naman, maghahanap ng mga doctor who are practicing PCCM. Again, basically, it will be to improve your health outcome. Okay, so if you will have a better health outcome if you have a PCCM that results from a good rapport with the physicians by the doctor. Then there's an empathetic or empathic and compassionate assistance from the physicians. So the main question being asked is, which will have a better health outcome? Doctors with skills in medicine, magaling in medicine, but without patient care center care management, or yung mga doctor na may skills with medicine, pero may kasamang patient-centered care management, meaning they are listening, they're informing, and they're assisting the patients. So, of course, no doubt about it, number 2 is the right answer here. So doctors with skills in medicine, magaling na magaling, but also with a patient-centered care management attitude would be the best doctors to look for, as they will produce a better health outcomes for the patients. What is the current status of PCCM in the Philippines? So at the moment, practically nobody's talking about it. As far as I know, and as of 2022, there is no documented, formal, structured program in a hospital. We're talking about hospital. Walang nakapag-publicize na baka merong mga patchy-patchy program pero walang formal, structured, documented program in a hospital. There is also no documented formal, structured, comprehensive program by physicians, this time doctors, seen in the internet. Okay, so except probably mine, because I published mine. Patient-centered care management program is very challenging to achieve in a hospital. However, it should be there, as I said, because of its importance. It should be part of the quality management system, incorporating at least the 8 principles of PCCM. You have heard a lot about hospitals being certified by ISO, by a lot of international accrediting bodies. Okay? And yet, you have we still have to find a formal program on patient care management program, okay, in the hospital. The board of directors should believe in its needs and enforce it to the letter. And all the staff from physicians down to the rank and file should believe in its needs, know how to accomplish it, and should collaborate in achieving it. This is really a tall order. On my part, I will try to contribute to the advocacy of patient care center management in a hospital by designing a program and teaching to hospitals. I'll try to write about it in the future. Let's now talk about my patient-centered care management program. As I said, I published this on the internet. So it's here. So this is the link, the history of ROJoson patient-centered care management. I started my journey on patient-centered care management in 1982 when I formally started my private practice in general surgery. The Pccm was not formally intensely taught when I was a medical student in the UP College of Medicine and in the surgical residency training in PGH. I would continuously improve my management of patients along the principles of Pccm using problem-based learning and self-directed learning. The main centerpiece of ROJoson Pccm management program is the patient management process, which I started in 1985, and which contains and integrates the principles of patient-centered care management. Again, on this side is a review of the 8 principles. Okay. So it includes, at least majority are there, okay, in that patient management process. Okay. The second centerpiece of ROJoson Pccm program is the patient empowerment program, which you're attending now, okay, which started in 2021. Okay. So this is a patient-centered empowerment program. So we are using the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, kapangyarihan, for the lay people or patients to gain greater control over decisions in the medical management of themselves. Empowering the people through this program by itself is already part of the patient-centered care management. So circa 1985, I formulated the management of a patient process, which includes the maxims, rules, and guides which will promote rational, holistic, professional, compassionate, and cost-effective treatment. And as I said, this management process incorporates a lot of the principles, the 8 principles in the patient-centered care management. Example, case in point will be, some of you who have attended this lecture before, patient management process. So a patient consults a physician. So I state the goal as follows: resolution of the health problems in such a way that the patient does not end up dead as much as possible with no complications and no disability, and in such a manner that the patient is satisfied. I like to underline this one: patient is satisfied. So that will be a reflection of the respect for patient values, preferences, and needs. Okay, so there is respect for this one, and also the achievement of all these goals of the medical goals, then the patient will be satisfied. Another portion, case in point, in patient management process will be the advice that I usually put emphasis on. Okay, I talk about 4 basic categories of functions of the physicians: establish rapport with the patient first, and then diagnosis. Then after that, give advice, then treatment, give advice, and then advice. Okay, so there are a lot of items here, advice items in these 4 functions, and this is also reflective of the elements, principles in Pccm. Here, when you give advice, you inform and educate the patient. When you give advice, you also give emotional support and alleviation of fear. Okay, you also involve the family and friends. Now, Another case in point in the patient management process, if there is a need for paraclinical diagnostic procedure, I usually advise the physician to use the BRCA. B stands for benefit, R risk, and C cost and availability. So like this. Okay. So with the data given, the patient is asked what he prefers. So when we ask the patient what he prefers, actually we are respecting their values, preferences, and needs. So on top of this, we are giving information and education, okay, because we give this data, and then access to care, usually cost and availability factor parameters will be the one that will accomplish the access to care. So example of a tabulation of data here, options for paraclinical diagnostic procedure, tell them the benefit of it's one of them, okay, and then the risk, and then the cost, and then availability. So after this data are given, the patient is asked what he and his family prefer. Another case in point in the patient management process is when you select the treatment plan already. So what is the cost-effective treatment procedure that will be used after the diagnostic test? Okay, so again, I also use the BRCA, and with the data given, okay, the patient is asked what he prefers. Okay, so here illustrates the table that shows the BRCA. So a very specific example, okay, procedure 1, 2, 3, okay, in terms of treatment, okay, data on the relative comparison of the three, and then relative comparison of the risk, and then the cost, availability. So after given all this data to the patient is asked what or he and this patient family prefers. Again, this illustrates the information and education being given as part of the patient's care, center care management, access to care, okay, availability, then the cost, respect for patients' values and needs, and also involvement of the family and friends. In that patient management process, you know, as I said earlier, I gave a lot of emphasis on advice. You can see there are a lot of boxes here on advice, 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 advice. Okay. So I usually advise the patient on the clinical diagnosis, the need and nature and results of the paraclinical diagnostic procedure, pre-treatment diagnosis and objective of treatment, selection of treatment, outcome of treatment, and then advice on health restoration and maintenance after treatment. So these are the usual principles that I teach to the physicians and also to the relatives. Okay. So always include the relatives of the patient in the advising if they are available. I usually ask the relatives to be around. Assess the psychological makeup, the health beliefs, and the level of competency of the patient and the relatives before making advice. Titingnan ko muna kung prepared na yung pasyente to accept some of my advice. And then make strategies that will promote rapport. Be honest but not brutally frank. Okay. For example, slowly divulge the diagnosis of an incurable disease or a frightening disease. Use terminologies or explanation that can easily be understood by the patient and his relatives. Then use all kinds of strategies that will make the patient and his relatives like you. Explain to the patients and relatives the processes that you use in arriving to the diagnosis, recommendations for paraclinical diagnostic procedures and treatment. So basically information and education. So the other centerpiece of my patient-centered care management program, as I said, is the PEP talk. I started it in May 15, 2021, still ongoing every Saturday, 2 to 3 p.m. Okay. So here I impart information and education to empower to empower patients. So we use the 4Ks: kaalaman, kakayanan, karapatan, kapangyarihan. There are other ROJoson PCCM programs aside from the patient management process and ROJoson PEP talk. As I said, these are the centerpieces. So one example will be, I have this program of no queuing, no long waiting time for patients. I started this in 2015 and still on in 2022 up to now. Okay. So here the patients do not have to wait for a long time during a patient consultation with me. So my pledge is that no patients will wait for more than 60 minutes in the book appointment time. And so far, for the past 7 years, or 6 years, or 5 years, because I didn't have clinic for past 2 years because of the pandemic. Okay. So I have 99% achievement in this pledge. Now, the other program activities project that I have under this PCCM is the Telemedical Consultation. So I formally started it in March 2022, right after the lockdown. Okay. So it's still ongoing because I want to give access to patient and then make the patient have a physical comfort at home, okay, while doing the telemedical. And I also have this indigent patient health program in which sometimes I give free consultation and discounted consultation fee when indicated. It operates gratis for those who cannot afford his professional fees, gives big discount on professional fee, allows down payment and post-dated checks for his professional fees, provides surgical material for free to indigent patients, etc. Again, this conforms to the access of care of the Picker's principles of patient-centered care. I also assist patients with financial disability. I call it PFD, patients with financial disability. So approximating the PWD. Okay. So here, I try to help them get the PWD card. Okay. Then also help them in being treated in hospitals with lower expenses. I also have this advocacy for use of generic drugs, okay, as an illustration of my conformance to the access to care. And then the medical prices data online publications, which I've been doing for the past so many years. Okay. Here I put down the prices to educate the patients that they have to consider the cost. Okay. So tell them where to get the cheaper materials. Okay. And then I also coordinate referrals to other physicians when needed. I do it myself. I don't just give a paper and then you just see these particular doctors. I have a lot of times I call up the other doctor and then ask and give them the information. I integrate the care of several physicians who are needed for a particular patient. Example, a patient's needing chemotherapy or radiotherapy after an operation. So here there's a need for several physicians. So I try to talk and integrate the care of these doctors for the patient. Then I ensure continuity and adequate transition of care. So I usually follow up the patients. Sometimes patients do not report to me, but on my own, I call them up, especially through the Facebook Messenger, and ask them what's happening to them. As I said, I assist patients with financial disability, getting PW card, D cards, and being treated in hospitals with the lower expenses. Another example will be the rain, flood, wind situations advisories from my clinic, which I started in 2017 and up to now, because I know that at times there are strong rain and flood situations that will either I cannot go to the clinic or the patient should not go to the clinic. So I advise them accordingly so that they don't try to take the risk. And then my minimalist and vigilant watchful waiting approach in managing patients this has resulted in patient value-based healthcare services and patients' experiences. Okay, when I say minimalist, I just prescribe and advise what is essentially needed. Then another activity that I had is the ROJoson Cancer Survivor Registry online site in 2011. So to give inspiration to cancer patients with cancer, with the patients looking forward to 10 years or more. So this is published in this particular website. So this is part of a patient care management program because I extend my treatment, emotional treatment to the patients with cancer. Okay. And then, so this particular program, as well as the publication, okay, in the internet will serve as inspiration to current and future cancer patients and will debunk the thinking that having cancer is always a death sentence. So the other activity that I had is the Cancer Crusaders Club in 1988. So to provide psychosocial support to cancer patients. This is still ongoing, and it's long. This is probably the longest running cancer support group in the Philippines. Legible physician's handwriting. I'm trying to advocate that, but I've not been successful. I try to be a role model because we know the importance of legible physician's handwriting. I'm trying to advocate this for the patient's sake. And then I also have this advocacy on medical records. I'm always telling the patients, keep your medical records. And then for the doctors, to give medical records to the patients. And also, this is my practice, giving duplicate copies of medical records to the patients so that they have a copy, which they need for follow-up to me as well as to other doctors in the future. So some more information and education will be on no to routine circumcision, beware of Santol seed swallowing, which we just took up last week, no to unnecessary operations and diagnostic procedures. Then information and education, also healthy lifestyle, advice on that. And then intentional living plan, including the advanced directives. So now as to my advocacy, as I said, I've been doing this advocacy on Pccm since 1985 when I started my patient management process. So the question is, what are the impact of my advocacy, if any? So honestly, I have influenced at least some of my Filipino physician followers, medical students, residents, fellows, established medical and surgical practitioners to follow suit, thereby improving healthcare delivery services in the Philippines. Kahit na konti, meron. Influence at least some of Filipino patients and lay people on what to expect and what to look for in their search for value-based healthcare services. Protected and saved patients from unnecessary medical procedures and their corresponding expenses and potential complications. Empowered Filipino patients and lay people, Filipino people, on at least knowledge on how to have value-based healthcare services for themselves, especially on the PEP talk. Okay. So it has brought a lot of delightful patient experience among the patients. And then the last question in this particular PEP talk will be to ask you now, how can you help me in the advocacy of Pccm? Okay. So we know the importance of Pccm in helping improve the healthcare outcomes when you're sick, or even if you're not sick, to keep yourself healthy. Okay. So I'd like to propose that you share this PEP talk to other people, lay people, as well as health professionals, your friends who are doctors. Okay. Feedback to hospitals. Sorry. through the feedback form. They usually have this feedback form, and they also have internet, they have Facebook pages, they have social media. So you can give them some feedback to say that put up a patient-centered care management program. And then lastly, try to talk to your physicians, your present physicians, and to convince them to do more PCCM programs. I'm sure they have some PCCM programs. You can say, try to do more. Probably one specific example will be, please don't allow us to wait for so long when we consult you. Okay. So try to have a no queuing program in your clinic. So with that, okay. So take summary and takeaway. So I've discussed what is PCC, what are the principles, why is it important for the physicians to practice PCCM, important for the patients to seek PCCM, and then current status, my patient care management program and patient care management program and advocacy. So takeaway in relation to patient empowerment, be always in touch with reliable medical information and patient-centered care management. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, kapangyarihan to gain greater control over decisions in the medical management of oneself by knowing the concept and principles of patient care management in your health management. So with that, I'd like to end my pep talk. I hope I have empowered you to have a better understanding of the concept and principles of patient-centered care management in your health management. So before we go to the QA, reminder again, OLETE, and then 50 OLETE certificates. Okay, most of you have gotten 50 OLETE certificates already. And then requests, please type in your feedback in the chat box if you're not going to have a feedback on the OLETE, in the OLETE. So let's now have a group picture taking. Okay, ready? Show your face. 1. Okay, last one. 1, 2, last call. 1, 2, 3. Okay. So the floor is now open for comments, questions, reactions, etc.
Doc, may I say something? This is
Sure.
Susan.
Sure, Susan.
Okay. Actually, first of all, I'd like to commend you for this advocacy, and of course, I wish a lot of patients and hospitals are doing this. But I'm quite concerned because in public hospitals, where there are a lot of queue for doctors' care and everything, how do we advocate this? And second, I don't know if I got you right. No, at the start of your lecture, you said, I hope I'm not mistaken. No, you said that there are no hospitals yet in the Philippines with a structured PCCM program. Is that correct?
Yeah, I hope I'm wrong. I hope I'm wrong, but I've not seen one. In fact, I was a little happy about several months ago in a hospital, which is, some big hospitals here accredited by international what do you call that? Like Joint Commission International from the US, and then the Accreditation Canada. Okay, so they try to accredit doctors and telling them to improve their healthcare delivery system, and then they give their certificate. Now, so a few months ago, so I was able to attend a lecture by the Joint Commission International to a particular hospital that has been accredited by it, and then it's trying to promote patient care centered management. Now, so when I heard about it, I'm so happy now that at least there's a move now to do it now. Okay. But in other hospitals, I don't think they have a formal program on that now. Okay. So when I say formal structured program, parang ilalagay nila in a manual that this is parang patient safety program. Okay. Infectious control program. May manual diyan ganun. So this time you can call it patient care centered care management program. Now, incorporating the 8 principles. Now, kahit na yung 8 principles lang, andun na. Pag andun, pwede na yun. No? Okay. So, but the hospitals can go beyond that. No? Okay. Now, in the government hospital, did I answer your second question, Susan?
Yes, Doc, I got it. Okay.
Now, for the first questions, I don't. I think if there's a will, there's a way, because in other countries they can do it. They avoid queuing. In fact, when I started publishing my experience in the internet, in the Facebook, a UP College of Medicine graduate who retired in the Philippines, who practiced in Sweden or Switzerland, no? So came home to the Philippines, and then he said that in Switzerland we do it also. No, we make sure that the patient does not make a queue for a long time, and in fact we charge them if they don't appear on time. No, okay. There's an appointment basis. If they don't appear on time, we charge them more, extra, di ba? Okay. So if there's a way, I think there's a way of doing it. Mahirap lang, no? Mahirap lang. Okay.
Another thing, last para ano naman, how come there are hospitals who are ISO accredited, but as you said, wala namang patient empowerment program na structured, and yet they are ISO accredited?
Yeah, when you say ISO accredited, there are a lot of mga some minimum items now, like how to run the hospital properly, efficiently, and in the right way along the quality principles. And then there are also mga items on how to manage patients. Now, okay, may mga elements doon. No? Okay, so this is just an addition. Okay. So may minimum standards that they can fulfill, kaya accredited sila, no? Okay. If they might put PCCM as another one, no? Example, yung mga accreditation may different levels. Minsan yellow, with yellow, then platinum, a gold, platinum, and then what's the other one? Basta based on the levels, no? Okay. So if they think PCCM is a good project, it's very challenging. No, if the hospital can achieve that, in place, then they can give them the highest accrediting, highest point, highest grade, no, accreditation. No, okay.
Okay, thank you, Doc.
Any more?
Yeah, I'll just be
Chuchi,
quick.
nice to see you again.
Yes, thank you. I will just be quick. You know, I'm actually nalulungkot ako after hearing your lecture, no? Because it's only now I realize na halos kayo lang pala yung gumagawa nito. Paano yun? There are more than 500 public hospitals in the whole Philippines, and I don't know how many private hospitals. And does that mean that nobody cares? Oh my goodness. Nakakalungkot. It's really a tall order. But anyway, we really appreciate you for this, no? Actually, I think it has to do also with our Department of Health, because I remember when we set up. Sorry, when we set up the Sinag Hospital Volunteers Foundation, it was through the initiative of Dr. Periquet. He was the department head. So at that time, we already knew that there was a lot of things lacking in our health system, and this is really one of them, no? They should look into this. The Department of Health should look into this para ma-standardize naman yung service. Yung service, di ba? I don't know, it's a massive thing that we are facing. It's no joke. But at least you have started something small here. And I don't know, perhaps I can bring it up because our foundation is still existing up to now. And maybe I can bring this up to their attention also, no?
Yeah,
so that
please
perhaps
help me
perhaps hand in hand we will be able to come up with something so that we can start small, and I don't know how.
Please help us help in the advocacy for the sake of the Filipino people. I remember when President Duterte started his administration. He has a health agenda, and then one of the items there is no queuing public hospitals. I was happy. I was very, very happy for that. Pero walang nangyari.
Walang nangyari. It's so sad. Our foundation is already 36 years old. Kasi since the start, we started during the time of Periquet, and up to now, it was carried on by the Focolare movement. I don't know if you are familiar with the Focolare. We have their support. So we are now present in 12 hospitals. All over the Philippines.
That's good.
Anyway, thank you for bringing this up. And I'm sorry I have to.
I'm doing my part, and I hope you can help me also. Okay.
Yes.
All of you out there can help me. No, you can give feedback to the hospital. That's the best that you can do.
We deal only with public hospitals. But anyway, it has to do with the Department of Health. So I don't know how we will be able to approach them and bring this up to somebody's attention in Department of Health.
But the Department of Health can have some influence on the private hospitals also because of
yes, definitely.
Because of the what do you call that? They have this yung mga giving licenses. Before giving the licenses, they ask them to meet the standards. No?
Correct. For instance, another example is whenever I have to go to a doctor for my consultation, I really dread the fact that I have to line up and queue, and I'm a paying patient and I have to line up pa. Anong klase? Meron namang appointment, pero yung hours hindi nasusunod. Sometimes you wait 2 hours because we really need it, especially the elderly, no?
So may appointment time, hindi na nasusunod.
Hindi nasusunod.
So at least may appointment. Yung iba walang appointment eh. First come, first serve. Di ba? Okay.
So I'm sorry, Doc, but I have to go because
Yeah,
I have
go,
a
sure,
prayer
sure,
meeting.
sure. I
Huh?
know, I understand. I
Yeah.
understand. Thank you for attending.
Thank you, everybody, and God bless all of us. Let's all help each other.
Yeah,
Yeah.
okay.
Thank you.
Okay. So, any more questions for those who are still around? So,
There is a comment here
okay.
from Rochelle de la Cruz. Thank you, Doc Joson, for your advocacy. We truly appreciate you. I just pray that more and more doctors will be like you, a doctor who aims to improve the health of the patients. You are truly a doctor with a big heart.
Thank you, Rochelle. Thank you.
Then there's another one from Susan Tan. Thank you for taking up a relatively novel approach to health management. Kudos to your selfless contribution. And
Thank
from
you.
Jocelyn
Thank you,
P.
Susan.
From Jocelyn P. Most of the time, a doctor's secretary is not cooperative regarding the no queuing policy. I have once lost my temper for I have an appointed time but waited for 4 to 6 hours for my turn.
Ikaw sumagot niyan, Abet.
Wait. We have a very restricted appointment hours with our clinic with Dr. Joson. When you are late, we have to find you for being the latecomers. So when you appointed to Dr. Joson and he has given you time, be sure to be there 30 minutes before your time. Otherwise, we're going to fine you. That's our policy. So you have to follow our regulation, but we always do it on time.
Yung fine naman, di ba? Hindi pa naman napafine na. Okay. Pero pantakot lang yon. No? Anyway,
Yes.
but Jocelyn, it has to, the doctor will have to be a partner in that program, not only the secretary. Okay, kung yung doctor does not really enforce the program to the letter, no, mahirapan yung secretary. No?
Yes.
Yes, Doc.
Yes,
I did
that's
the
correct.
sumbong thing. I tried sumbong. Pero
But it's-
no effect.
But from Jocelyn, the secretary has nothing to do with it. Because if the doctor sees the patient too much or beyond the time of your appointed time, for sabihin natin yung patient na tinitingnan niya, sumobra oras niya, the secretary cannot do anything. We cannot tell the doctor to stop it because there's a next appointed patient.
Yes, I know that's true. Pero I told the secretary, I just live sa tapat ng building nila. So I requested the secretary to just give me a call kung malapit na sa turn ko. Ayaw ng
Yes.
secretary. Kaya I
Yeah.
waited for that long time.
Yes, that's correct.
Okay.
Yeah, I do that with Dr. Rodici. Pag I just call the patient before coming over. But with Dr. Joson, we really implement the strict appointed time. You have to be there 30 minutes before the appointed time.
Okay.
Otherwise, you will be fined.
How much ang fine?
It depends upon the minutes. Kung ilang minuto ka na late.
Sabi ni Doc, wala pa na fine eh.
Wala pa naman so
Wala
far.
naman. O baka ang fine namin is kung late ka, lalagay ka namin sa huli.
Yes,
Ganon.
that's
Ganon.
correct. Kasi
Last
in the
time,
next
ganun kami. Last time,
the next
ganun.
appointed one kasi maaapektuhan yun eh.
Mm.
Halimbawa, your time is 8:15 and the next one is 8:30. So when you arrive 8:30, doon ka na sa dulo. I'm strict with that.
Fair naman, fair. Huwag lang mangyari sa akin sana.
Kasi mamumove yung time eh. So magtataka naman yung patient, sasabihin, Beth, I'm 8:30, bakit naman ano? So hindi pwede yung ganon. So you have to be there 30 minutes before your time. Di ba,
Yes.
Cheng?
Baka na late siya.
Tama po yun.
I'm very strict with the time.
Okay.
At saka po pag maaga kasi man at wala pa po yung the next na patient, doon po, mas nauna po ako dun sa, sa time ng
Yes.
doctor.
For as long as hindi masasagasaan yung time nung the next patient.
Yeah, may flexibility rin ako. No? That's why it has to be a joint collaboration between the doctor and also the secretary. No? Magka-coordinate dapat yung dalawa. No?
Yes. Pag halimbawa, wala pa yung kasunod, then I will ask Dr. Joson, pwede ba natin papasukin yung nandyan na in lieu of the next patient?
Okay.
Flexible.
Okay. Kaya
I have
patient-centered.
another question.
So what is the Tagalog word for patient-centered?
Pag-aasikaso.
Dok, ang hirap. Ang hirap.
Kasi
I-translate.
kapag yung patient empowerment, we were able to get four phrases, di ba? 4 names. Kapangyarihan, gano'n. So how about patient-centered?
Wala po ako naisip.
How about the others? Para we can promote it.
Yes.
Pag-aasikaso, pag-iintindi.
Tamang pag-aalaga kaya, hindi naman kaya.
Yes, that could be.
Pag-alaga, malasakit.
Tamang pagmalasakit, pwede.
Para we can promote it in the Philippines. Come out with the Tagalog term, phrase. Anybody?
Pag malasakit.
Malasakit. Malasakit.
Malasakit.
Malasakit sa pasyente, patient.
Yes.
Malasakit.
Yes.
Pagmamalasakit sa pasyente.
That will encompass everything, no?
Yes.
Malasakit in terms of malasakit. Kasi basically it's kasi kaya itong lumalabas na patient-centered movement kasi yung mga doctors a lot of times they don't, parang paternalistic ang approach nila eh. They decide ano kailangan ng pasyente, ganon, period, na? So they don't listen to the patients kung anong gusto nila, anong priority, anong preference nila, na? Kaya lumabas itong patient-centered, na? That's why the initial definition is the doctor should be listening, no? Informing, yung pa isang kulang. Most of the doctors, they don't inform. They just say, oh, eto kailangan mo, period. No? Okay. No, walang ibang options na binibigay, i-explain. No? And then they have to educate the patients also. Usually they don't have time to educate the patients. And then the one thing that I have added is that ako lang nag-add yun, assisting the patients. You have to assist. You have to be truly compassionate to assist the patient. Kung hanggang kaya mo. Hanggang kaya mo. Okay? Of course, as a doctor, as a hospital, they don't give out free, di ba? Okay. Kung may financial capability, financial problems, they don't give out free, di ba? But at least they can probably try to help in one way or another. Either pwede, teach them how to get the PWD. Parang ako. Okay. Parang ako as a physician, no? The patient who has been a new patient, may bukol sa breast, no? So I think breast cancer siya and then needing an operation. So right away, kahit na hindi pa siya senior, no? So wala siyang senior benefit, di ba? Senior citizen benefit. So dinayapsi niya agad, no? Then get a diagnosis of breast cancer. And then right away, ask her to go to the municipio to get a PWD. right away. No? So, yung madali lang kumuha ng PWD eh. No? Okay. So, itong last time, I was able to help one patient, two patients na, no? 59 years old lang, no? Or 44, may breast cancer. So, biopsy ko, breast cancer, wala pang operation, ha? Then, I asked her, go to the municipio and get a PWD. Kaya may 20% discount siya, no? Aside from the PhilHealth, no? So, itong latest one, another one, last Tuesday, we just had a breast cancer patients, which I think talagang breast cancer. So, binayopsy ko lang de Carayo. In 4 days time, we were able to get the results, no? Positive for cancer cells. So, sabi ko, punta ka na kagad sa munisipyo before I operate on you 2 weeks after. Okay. So, may kukuha siya ng PWD, at least may 20%. So that's an example of how a doctor can help the patient financially. No? Okay. An example lang. No? Okay.
Doc, another question.
Sure.
This is Susan again. Ano? I was wondering, are hospitals required to post in each room of the patients a patient's rights?
Again.
Are hospitals required to post in the rooms, especially in patients' rooms, patients' rights?
Oo. Meron.
Meron ba?
But not in the patient's room. It's yung brochure. Dapat meron yung brochure. Meron. And then, kasi yung mga ISO certified hospital and also DOH before you get the yung license mo, they examine you, di ba? So there's a requirement that you must post your patient's rights and privileges. Okay.
But I don't see it in all hospitals, not all in the hospitals that I have been to.
Hindi ko lang alam ngayon, but when I was very active before, nakikita ko, no, meron, no, because I was part of the mga ISO, yung mga accredited, in quality assurance, no. So pinapa-post namin, no. There must be kasi required by by DOH, no.
Okay.
Ang problema na lang yung content nila. Which I try to improve kasi kopyahan na lang yan just to fulfill the requirements. They just copy whatever is about patient's rights, ganun. And one thing that they have not published sa patient's right, ang dinagdag ko lang because I am a malasakit na sa pasyente, I said, you should include there as part of the patient right is you should bill us properly and correctly. A lot of times maraming mali di ba? Tama? So, yan ang suggestion ko, no? Okay. Later on after this one, I will get hold of my writings on that one, no? I'll share it with you, no? Yung writings ko was there for mga 10 years ago pa yon, no? Okay.
Thank you, Doc.
Okay. Okay. So last call for any questions, comments. Lana?
Hello, Doc.
Hello.
Aida.
Aida. Yeah, Aida.
So sorry po, matagal ako nawala. Pag nawala po ako, Doc, nasa church activity ako.
Yeah.
Doc, so na-amaze po ako talaga. So thankful and grateful sa inyo pong nakikita ko po advocacy. Hindi lang po sa pagtuturo, ginagawa niyo po. Doc, parang naiba. Hindi mo pa kayo nadidiscovery ng Department of Health? Kundi iboboto ko kayong secretary. Kung may power lang ako magrekomenda. malaking pagbabago po yun ang inyo pong magagawa, maituturo. Lalong na po kasi ministry namin among the poorest. Saan po kami, may member po kami sa DSWD. Kitang-kita ko po talaga yung kaibahan.
Yeah.
Na yung lalong pag yung financially related po ang problema nila. Lalo na po meron sa DSWD yung mga homeless, walang pamilya. Sa public hospital po kasi talaga dadalhin ng DSWD. And kailangan po yung ganong pag-aalaga.
Yeah, kailangan.
Kaya thankful po sa mga indigent yung pong programa nyo din po.
Yeah.
Saludo po, Doc.
Thank you. Thank you.
Thankful and grateful for having you.
I cannot be, hindi ako pwede doon sa Department of Health.
Akin po.
Ang gagawin ko na lang, I'm more effective in trying to be a role model na lang. Role model.
Okay po.
Role model. And then, probably you
Sana
can...
po makarating sa DOH ang inyo pong advocacy.
Yeah.
Malaki pong tulong sa mga hindi na po indigent, yung pagbabago po ng system dito.
Yung pagbabago.
Kasi kung ikukumpara nga po sa ibang bansa, wala po tayong sinabi kahit may PhilHealth.
Yeah. Okay.
Oh,
So I hope you can, ganun, Aida and the rest, no? As I said, I'll do some practices that will be patient-centered, and then try to be a role model. And then I hope all of you will invite parang meron tayong critical mass na coming together. So I hope you can invite more people to attend this pep talk. Kasi I will continue on with this patient empowerment program. Kasi patient empowerment program is really a patient-centered program. Diba? You cannot deny it. Diba? Talaga patient-centered program.
Naisip ko lang pong Tagalog, Doc, tutok eh. At sinabing centered. Nakatutok. Oo, tutok doon sa nakasentro, nakatutok sa pasyente.
Tutok.
Dok, pagkalingang may malasakit sa pasyente.
Yeah. Meron pa dito, Doktor. Ma'am Jocelyn, thank you so much. Meron pa dito from Mrs. Coloton, pagkalinga.
Pagkalinga.
Yes. At tapos from Ma'am Jocelyn, it's pagkalingang may malasakit sa pasyente. And then a comment from Aida Antonio, mapapawaw talaga ako sa advocacy niyo po, Doc. So grateful and thankful for having us as our doctor. And then from Susan Argel, yes, President BBM should get you as his DOH secretary.
Ano yung pagkalinga? Ano yung ibig sabihin? Maria Husta. Pagkalinga. Complete.
It's in English. Care.
Care.
It's care. Care. Pero it's nurturing care.
So how do you transform it into a buzzword, buzz phrase? Pagkalinga ng pasyente,
Oo. Yung sinabi ni Jocelyn, tama yun. Malasakit.
Pagkalinga at malasakit sa pasyente.
Pagkalingang may malasakit sa pasyente.
Sige, titingnan natin. Medyo mahaba yan.
Mahirap i-shortcut, Doc.
Sige, I will consult you more. No? Let's try to coin a term for that. No? Para we can promote it. No? Okay.
Thank you, Doc.
Okay. So we call it a day. It's 3:20.
Bye.
Thank you, Doc.
So next
Thank you,
week,
Doc.
next week
Thank
we
you,
will
Doc.
be talking about Breast Cancer Consciousness Month. Breast Cancer Consciousness
Okay.
Month kasi yung October eh. So, hahabulin ko lang. Habol ko lang. No? Okay?
Okay, thank you, Doc.
Thank you, Doc.
Okay.
Okay, thank
Bye.
you. Bye,
Bye.
Doc. Thank you so
Doc.
much.
Bye.
Bye-bye.
Bye.
God bless.
Bye, everyone.
Bye.
Bye.